Hi, Dr. Marian Owen with Whole Family Medicine. You may have noticed that it's been some time since I've made a video because I have been avoiding it. The rise of the Delta variant has gotten me a little upset and depressed, and it's taken me a lot of time to figure out how to do this without showing too much of that. So here we are. We're in Georgia. It's August, and the Delta variant is on the rise. We do not have enough of our population vaccinated to prevent widespread community transmission, and so we are at that place again where we have exponential growth in the numbers of people that are getting sick with COVID. Our hospitals are getting overcrowded again, and we're in trouble. So, how does that affect those of you who aren't vaccinated? Well, the rules for you haven't ever changed. You should always be masking. You should be isolating as much as possible, minimizing your exposures. Everything you were doing for the old COVID, you need to be doing for this one and more, because this one spreads more easily. For those of us who are vaccinated, the rules are not as clear. However, I am acting as though I could at any moment in time be infected, not know it, and be transmitting it. And so I am doing everything I can to not transmit it to other people. I am wearing my mask. I am doing social distancing when I'm outside without a mask, 6 feet apart. Because this is more transmissible, you might even want to broaden that some, but that guidance has not become clear. Still clearly an aerosolized droplet spread, so masks are preventing you from spreading it, and if you're with someone who's masked, they're preventing it themselves from giving it to you. So when you're choosing to be with another person, you need to think about not just them, but their contacts and the behavior of those people, because if they're vaccinated but they're living with someone who is maybe being more socially outgoing and being in crowded spaces, that person could be bringing the COVID virus home, and then they might have an asymptomatic case or mildly symptomatic, that they just have a cold, but they're not getting tested because they've been vaccinated, and so they're able to spread it to you, or vice versa, you could spread it to them. So don't just think about their contacts and the behavior of their contacts, but think about their contacts and their vulnerabilities. You don't want to be the person that introduces COVID to a family and then an elderly or compromised person gets ill. You don't want to be that person, so be very careful. I am concerned as our children go back to school. Very few of our school-age children are vaccinated, though probably close to 50% of them are eligible to be vaccinated. More like 23 to 25% have been, and that is a tragedy. But this is a very clean vaccine. I'm not worried about it in children, and the mild consequences that we've seen have been far outweighed by the consequences of getting COVID. We do see long-haul COVID in children, even children with mild infections. We do see some children getting very, very sick and having a hard time getting back to normal. So it's not to be ignored in children. So support your school, support your child, make sure they're wearing their mask, make sure they're hand washing, make sure that the school has good ventilation, make sure that the environment that your kid is going to be in is safe. If you have any questions about that, you can give us a call and we can support your decision around your child's schooling for this year. I do want to address the vaccine and the vaccine hesitant among you more directly. There are a few of you that I've heard from that have chosen not yet to get vaccinated, and I think that it's time for you to reconsider that. So I'm going to just address some of the things that I've heard those of you making that choice say. One of the concerns that I hear is that it's not yet FDA approved. Well, it doesn't have full FDA approval yet, but it does have FDA emergency use approval. And had the vaccine proven to be extremely dangerous or even mildly dangerous, that approval would have been reversed. So we are in an emergency situation. We are in a pandemic that is killing a lot of people, and getting vaccinated for any individual person is lower risk than getting COVID. And so the approval is pending. It's coming. There's nothing that's going to keep it from getting approved that we've seen in the data, and it's a very monitored vaccine, I promise. I personally have made 3 reports to that VAERS site that people cite as though everything there is a death. Everything there is not a death. In fact, almost nothing there is a death. The 3 I've reported, one had prolonged abdominal pain, one had prolonged flu-like illness, and one had frozen shoulder, which is common after any vaccine if it's given too close to the shoulder joint. So nothing that was remarkable, but things I thought were worth letting the people who monitor vaccines know. That's why there are so many reports. This is a new vaccine. We are being extremely careful. Doctors are reporting. Individuals are reporting. And so far, nothing in that noise except for the blood clots from Johnson & Johnson, which is why we recommend that women under 50 don't get the Johnson & Johnson, and some early concerns about myocarditis and pericarditis in children who got the vaccine. And those are real but rare and much less common than other cardiac consequences of getting COVID. So still, in that small setting, the risk-benefit is pro-vaccine. Another thing that I hear is, oh, it's a new technology and we don't know what the long-term consequences of this vaccine are going to be. Well, it is not a new technology. It's been in development for over 30 years. It's been studied extensively. It is a new application of this technology. But the thing about science is, and this is another example of that, it does tend to get better and better and better. And with this vaccine, this technology is extraordinarily clean. They have figured out how to insert just a very small amount of mRNA, just the amount that instructs your body how to make the protein that is spike protein. And so your body sees only spike protein, it makes antibodies against spike protein, it generates a full immune response against spike protein and nothing else. So no other part of that virus is in you. Your immune system then knows how to fight that virus when it comes into your respiratory system through an air. It says, oh, I've seen that before, let me fight that off. There is nothing else really in the vaccine. There are no adjuvants, there are no cell cultures, so there's no like bits of egg, there's nothing. There's nothing in this thing. There's no adjuvant, there's no preservative. And those are the things that have always made me a little circumspect about vaccinations in general. Still, I would never have described myself as an anti-vaxxer, but a slow and careful vaccinator. And I still feel that that is exactly what I am. I measure the science, measure the risks and benefits to any given patient, and I try to make careful recommendations based on that. And my careful recommendation based on that is that you get vaccinated if you are eligible. Long-term consequences we don't yet know what will happen in 3 or 4 or 5 years after this vaccine. One, I'm just not very concerned about that because there's nothing in this vaccine that's lingering in us. The only thing that's lingering is our immune response to spike protein. So if our immune response to spike protein is dangerous or spike protein is dangerous, getting COVID, you're going to get a much higher exposure and a much different immune response than just the spike protein. And so the long-term will be less than if you were to get the infection. There's no way it can't be less because there's nothing else to it. There are also a lot of claims that thankfully I've not been hearing from my own patients, but which I have seen online, that I just have to say are pseudoscience. They are taking little bits and sciencey sounding words and wrapping them in a lot of fear and a lot of, quite honestly, science fiction, imaginary, this could happen. mRNA cannot be reverse engineered into DNA in our bodies. It cannot insert itself into us. There's all kinds of other, honestly, just wacky stuff out there that is just infuriating. And that people who call themselves doctors are saying those things is completely infuriating to me. There are also people that are still asking me for things like hydroxychloroquine and for ivermectin. And what I will say about those is that hydroxychloroquine has been proven to be not helpful and in fact possibly dangerous. Ivermectin may have use in critically ill people who need to be hospitalized, but in the studies so far there is no evidence of early benefit in people who are not seriously ill. There is some evidence for inhaled budesonide, which is basically an asthma medicine at very, very high doses in non-hospitalized patients. So if you do get COVID and you are at risk, I would call that in for you, so please do let me know. But that is the one early thing I'm doing. The other things that we have recommended before, high-dose melatonin, good doses of vitamin C and bioflavonoids just to support your immune system's antioxidant work. Drawing a blank. I think that's it. All that stuff I said before, go watch the other video. All that stuff is still true. Get outside, get your exercise, get in the sun, love your family, be careful with yourself, watch your exposures. Take care of yourself, be safe, and know that you are loved.